State University of New York at Downstate Medical Center is your center for healthcare excellence. Housed in an urban setting in Brooklyn, New York, Downstate is one of 64 campuses in the State University system and the only medical school in Brooklyn. More New York City doctors graduate from Downstate than from any other medical school in the country. Health Center is sponsored by SUNY Downstate and delivers up-to-date information in healthcare and community outreach programming. Its university hospital is known for its centers of excellence, quality patient care, cutting-edge education, as a major scientific research center, and for its emergency room, which is open 24 hours. SUNY Downstate's educational programming includes our School of Graduate Studies, which has trained some of the world's best scientists and teachers, including Dr. Robert Furchgott, winner of the 1998 Nobel Prize in Medicine. Also included are the College of Health-Related Professions, the College of Nursing, and our nationally recognized School of Public Health. With so much to offer, there's no better place you can depend on. Downstate.
Live from the Health Center at SUNY Downstate, this is Star for Brooklyn.
Welcome to Star for Brooklyn. I'm Tanya Taylor, and this is
Christopher Jimenez. Glad to be back with everyone. So Tanya, speaking of coming back to things, so our hashtag, Be Healthy For You.
Yes.
I just want to check in with you.
Check in with me.
How have you been doing in your exercise program?
Okay, so I have been getting to the gym, not as much as I'd like to, but I want to share with folks that I am really, really taking my health seriously.
All right.
So I've had some issues with my knee, and
are you okay? I mean, is it a serious issue? Or?
No, thank goodness.
Good.
But I know that it's not serious because I was really taking my health seriously. I went to the doctors. I didn't sit around and think, oh, this will go away. I spoke with my primary doctor. I went and I had some x-rays. I had an MRI. And as it turns out, I just really need to get to the gym. Okay. So I am now even more dedicated to trying to work on myself and trying to be healthy for me. Okay?
That's great.
How about you?
Well,
now you were running?
So I'm still doing a little bit of running. I'm looking to run 15K, which I think is about 9 miles or something like that. So that's gonna be in July. I'm hoping.
Oh, can we come and support you?
It's all the way up in Utica.
Okay, never mind.
Yeah. Well, my sister-in-law lives up there. That's why. Okay. So, but no, actually here. So what I've been doing is my son is into basketball now, which knock on wood, because kids they get into things and then they leave them behind. But he's into basketball now, so my extra little exercise is I'll go and shoot the ball with him for a little bit. Excellent. So again, we're not like running full court and going up and down and doing all this, but it's something we're moving around. And instead of sitting at home watching TV or looking at our phone or looking at an iPad, we're outside, we're together, and we're moving around, which all of that stuff is how you're healthy, right? How you stay healthy.
I'm so happy that you brought up your kids because I need to say that I'm really doing this so that I can be active with my kids.
Yeah,
because my
definitely.
Kids do capoeira, karate, soccer, and I don't want to be that mom sitting on the sides, barely able to catch up. So
yeah, definitely.
I'm being healthy for me, but it's also about the kind of quality of life that I want to have with my family.
Yes, definitely.
And aging well.
And speaking of the youth, right? So our kids, they're young.
Oh, we have a great program today.
Yeah. So we're going to be speaking with we're going to be speaking with 3 guests. 2 of them come from the Theo organization, and 1 of them comes from Pride Path. And so both of these programs are dedicated to reaching out to LGBTQ plus youth, which is very important. And I'm really looking forward to hearing about their programs and what they do.
Right. And we also have the director of our LGBTQI clinic here at Downstate, and he will be here to also sort of talk about how we are advocating for LGBTQI health here in Brooklyn.
All right, it's going to be interesting. It's going to be a lot of fun too.
Yeah. Absolutely. Hi, and today our first guests come from the Theo program at SUNY Downstate, and Theo stands for Team Helping Each Other.
Yes, our guests are Roma JeanClaude and Agbola Alawiya, and both are youth health advocates who grew up right here in Brooklyn, New York.
Excellent, welcome.
Welcome,
Hi,
guys.
good morning.
Nice to
Thank
see
you for having us.
Yeah.
So, Romy, real quick, I would like to ask you, we know Theo's an adolescent program, but what type of adolescent program is it? If you could give us a little bit of a rundown.
Well, basically, we focus on all things like teaching at all different types of schools and anywhere that really focuses on giving back to the youth, like any like outreach specific places. And we basically do a lot of things. Like I said, facilitating workshops. We go to like events and stuff. We do something called Table, where we give out the information and we kind of like use that as an opportunity to bring on youth as well. And we do a lot. Like we do like theater stuff as well. So it's like a bunch of stuff underneath that. But our main focus is that we keep it youth based. So it's like for teens by teens, if you know what I'm saying. But yeah, that's basically what it's all about.
So really, it's about reaching out to the adolescent population, the teens here in Brooklyn.
Yes.
But using different methods, whatever's kind of maybe trending at the time.
Right. Like social media posts. That's kind of like what we something else that we kind of do, as well as basically just going out there and just making sure that we are very much interactive with the youth as much as we possibly can, mainly through like table-ins as well as the base conference that just passed. Mainly those methods. The more trendy method would be like social media posts and stuff like that.
So I have a question. So the program has an emphasis on health, right? Could you tell us about some of the health programs or the things that you are targeting?
Well, we mostly target things like STDs and HIV awareness and stuff like that, and then we also target like pregnancy prevention as well. Yeah, those are like the main things that we like to focus on.
So sexual health.
Yeah, sexual health. Yeah.
Okay, excellent.
Agbola, as somebody who grew up here in Brooklyn, how has it been working with teens in the community here?
It has been an interesting experience, to say the least. It's really, I guess it's an interesting experience with the fact that like we're the same age, we're around, the same age bracket, so they don't really have to, listen to me. We have two different levels of information in terms of sexual safety, so it's interesting to see like how little people my age know about sex and how much I can teach them about sexual safety and, protecting themselves.
But I thought that peers, like being the same age, would make people want to listen.
No, yeah, that's what I typically think. But sometimes, like I think when I go to schools, I think to myself, oh, these kids don't really have to. They don't have to listen to me. We look alike. We look the same age. What gives them what makes them think, oh, this guy is official. We should listen to him. But then when I get to classes and I like start teaching and I get into the flow of things, most of the students are like willing to listen and cooperate and take in the information that's being given to them. So it's a really interesting experience, to say the least.
Okay.
No, I think it's important, because no matter what, like you said, you guys are from here and you look a lot like the kids you're dealing with. And Tanya and I just said it off camera. We're not old, but when adolescents look at us, they're probably like, "Who are these dinosaurs?"
Right.
Like, we're going to take information from them.
And we try to do this work, and it's difficult because of our generational gap. And so having a program that focuses specifically in terms of peers helping other, young folks helping other young folks, I think is really an amazing project. I wanted to ask, what are some of the real pressing issues for the youth in our community right now? And I know that there's a focus on sexual health, but beyond that, I would imagine that you see a lot of other sort of issues that are emerging.
Among our demographic, I would say, other than sexual health, I would say like violence. I would say like violence. I would just be like anything that kind of targets us as like a demographic in a way, and mainly through like police brutality and stuff like that, like discrimination and racism. That's kind of like something that I see that isn't really being, it's really not being brought to the forefront as far as like youth being aware of it as much as we would like them to be. And that's kind of something that we kind of implement in our like movements and stuff like that, because not too long ago it was Trans HIV Testing Awareness Day, and then my boss kind of brought up the fact that, oh, you don't want to like slide in the fact that it's a lot of like trans murders going on and stuff like that, and then I was kind of like, but I regret that honestly, because it would help bring that to the forefront as far as like our audience and stuff, because that is something that's going on, especially in the Black community, and it's very much like violence and stuff like that, just violence towards us that isn't sexual related.
Well, it is, isn't it? I mean, all of these structural factors, whether it's violence, poverty, you know, all kinds of forms of discrimination and stigma, these do have an impact in terms of sexual risk behaviors, right? So that's the reason why I asked. But are you also doing PrEP?
Yes. That's, I failed to mention that, but yeah, we like to implement PrEP into
promoting
our
PrEP,
curriculum. Yeah, promoting PrEP into as basically as much as we can, because that's like the forefront next to HIV and next to sexual health is like that stuff, in PrEP is like what we like to like message spread and stuff like that. So.
Agbola, what are some of the issues you've seen working with the teens?
I believe, in my opinion, some of the issues that are affecting teens are misinformation and, like Romy said before, stigmatization. Because when I go to schools a lot, when I go teaching at schools a lot, some of the times when I ask for like certain information, it's like, oh, do you guys know how to use a condom? Do you guys know what kind of condoms are present? Are present? You guys think it's safe to use 2 condoms at the same time? Typically I get answers that like go against go against like what I've been taught, and that wouldn't be correct in like normal sexual education environment. So I believe that a lot of the problem is the fact that we're not teaching the kids in our community enough about sexual safety, at least for like the amount of sex that like at least I hear is being had in my community among kids my age. But we don't inform them a lot on things in terms of safety, contraception, getting tested. A lot of people stigmatize testing to being something that you would only have to do when you get an STD, right. Or like when you've already gotten your ailment, you've already been affected. I try to dispel that stigma by telling the people I teach all the time, it's okay to get tested even if you don't have an STD, just to make sure you know your status.
Wow,
Great.
You guys are amazing. Thank you so much for coming. We will absolutely have to have you back to continue to talk about some of your programs.
Thank you for having us.
No, definitely. It's been really great to learn about what's going on outside. I mean, look, I made a joke about us being old, but the fact
We're
of the
not
matter is
old.
we're not old, but we're not teenagers. We're not teenagers,
Yes.
and to know what's going on from their point of view is very important.
Absolutely. And because that's a really important population that needs think about being healthy and to start those healthy choices now.
Yes,
early.
exactly.
Sexual health, diet, physical activity, it all needs to start early.
Just understanding you have a voice, no matter if you're young, you have a voice.
Exactly. Wow. Okay, so our next presenter today is Saleem Butler, who is the Youth Pride Program Manager at Brooklyn Community Pride Center. And Saleem, hey, come on over, Saleem.
Saleem, nice to
Hi,
see you. Thanks for joining
welcome.
us.
Thank you for having me.
Welcome.
And Saleem is going to be talking about this really incredible program called Pride Path.
Awesome.
So Saleem, going into Pride Path, tell us a little bit about it. I got to say, I'm not familiar with it, so I'm really excited to hear about some of the details.
Yeah, so this is our piloting season of Pride Path, and Pride Path is a workforce development program for LGBTQ plus youth, 18 through 24. So what Pride Path does is we provide professional development training, which deals with like hard and soft skills to teach the youth how to interact with people, time management, those sorts of things. And then we try to place them into an internship thereafter. And we're particularly focused on placing youth in a program where they can be affirmed in the workplace, right? Because we know that we experience like discrimination when you identify, especially like if you identify as trans, that kind of being a forefront of the movement right now, but also being a thing that people are still learning about in the general culture, right? And so especially when it has to do with workforce. And so what we try to do is place people, teach cultural competency to businesses, and then teach the youth of what they need to do while they're in the internship. Yeah.
Wow, that's amazing program. I do think that probably our younger people, all of our younger people, whether they're in the LGBTQI plus continuum or are not, need help learning how to be professionals in the workforce. But could you tell me a little bit more about how the community that you serve in terms of our LGBTQ plus community, the particular struggles or challenges that they might have beyond discrimination in terms of, are they not getting the kind of mentoring, or are there other sort of developmental things that's making it really difficult? I would imagine just dealing with coming out and
we have youth that deal with displacement from their families for whatever reason. Like I mentioned just a few seconds ago, dealing with trans women of color, trans people in general. That's become like a thing with people trying to get jobs, and so kind of like pressing through those types of barriers is what we deal with. So additionally, from like workforce, one of our main things that we're dealing with in the program is homelessness amongst LGBTQ youth. And so, that's one of our main focuses, where we're trying to figure out how do we break down that barrier, how do we, get involved in organizations that are providing housing, how do we work with the shelter system, to make sure these are safe places for our youth, especially our queer youth to be in. And so, dealing with workforce and dealing with homelessness, those things work hand in hand.
Yeah,
when you're trying to get, you can't get a job, you can't focus on work if you're homeless. And so those are one of our main issues that we're dealing with in the program, and trying to figure out ways to combat that and to provide housing for our youth. Yeah.
Thinking about a friend who's a trans woman who was in transition, and her particular struggles as she was transitioning to become her fabulous self, but she was employed before and was transitioning through. And so for individuals who are then experiencing, this question is specifically about the transgender community, what kind of things in terms of helping employers understand legally what they can't do, or also to help kind of strengthen their cultural competence, to get them to realize that, yes, you may have known Jose, but like Jose, is no longer Jose, and you need to respect, even though on paperwork legally he might still be Jose, he's Juliet, and you need to meet people where they are.
Right. So there has been like some legal things that have passed over the last year or so, where you actually have to call people by, it's illegal to not call people by whatever their chosen name is.
Awesome.
And so there are certain policies that's being pushed forward in the community to make sure that these things are protected, and so that they do.
That's a New York policy.
Yeah, that's a New York policy.
Not
I don't think it's a national policy, but I think it's a New York policy. So there are those legalities in place. So that doesn't take a lot. We just this is where you need to change. Come up in your policies as well. And so, that's what's happening as far as that is concerned. And also, we teach basic, trans 101 to, to businesses and companies about, making your bathrooms gender neutral, letting people self-identify in the workplace as well, right? Not necessarily like calling people by pronouns and gender, but letting them identify who they are and as they transition as well. We also teach the youth how to know your rights in the workplace, so they can know what their rights are, how to go to HR if they have a problem, and how to handle that, without, the emotional, popping off, or, what I mean, but how to go about this so that it can, transition into something positive.
Man, we have to have you come back because this is a really important topic, and what you're doing with Pride Path is just phenomenal.
Thank you.
Thank you so much for taking time to come.
Appreciate it.
Thank you guys for having me.
Thank you.
Welcome back to Star for Brooklyn. Our last guest, very special guest, is a doctor in title, but anyone who's crossed paths with Hector will tell you that it's like talking to the cousin that you can't wait to see at the next family function.
Absolutely. It is my absolute pleasure to introduce our next guest, who is my friend, Dr. Hector Ojeda Martinez, who is an assistant professor here in the College of Medicine in the Division of Infectious Disease with me at SUNY Downstate Medical Center. And you are the Director of HIV Prevention and the LGBTQ+ Health Initiative. Welcome.
Thank you. Very excited to be here.
Oh, we're so excited.
Great to have you here, Hector. So I guess real quick, the first question is give us a little bit of an overview of the LGBTQ+ clinic at Star Health Center.
So we do so many things. So first of all of our staff is trained to be sensitive to LGBTQ issues and stigma. I think that's very important to say. But we do primary care, we do PrEP and PEP, regardless of insurance. I think that's very important for patients, for people out there to know. We provide hormone replacement therapy for the transgender folks. We have mental health services, counseling, substance use counseling. We do also buprenorphines for those who are LGBTQ and also have substance use disorders.
Right, so you do it all. So someone who just doesn't have a doctor, but they are on the LGBTQ spectrum can come there and sort of like, I need to get my diabetes managed, but I don't have a doctor, and I want to have a doctor who's also gay like myself. This is the space and the place that you guys are trying to create.
Right. Not all of our doctors are LGBTQ, but we are all allies. So that's something very, very, very important as well.
Yes.
So I travel 20 miles to get to my doctor because when I was looking for a doctor for myself, for my own primary care, to make sure that I don't get diabetes, that I don't develop high blood pressure, and that I stay healthy, I was looking for the things that we offer at Star. I wanted an LGBTQ doctor, and a clinic that had the same services that we offer in Brooklyn. In Brooklyn, there's not that many. I think we're the only LGBTQ clinic in all of Brooklyn for the time being. And I live upstate, and there's only one doctor that's LGBTQ, at least open, in Westchester. And I think we're a special place because we care, and it's more like a family than coming to the doctor.
Yes, absolutely.
Hector, you were talking a little bit about cultural competency, and one of our previous guests, we touched on that a little bit. And I've actually been in one of your cultural competency trainings, so you facilitate some of those trainings here at Star. When you discuss cultural competency with, whether it be students or staff here at Star Health Center, what's the main message you try to get to them? Because cultural competency, we were talking about this, it's always evolving, it's sprawling, it's vast. But if you had to, which is difficult, if you had to give condense it, what's the main message you want to give when it comes to cultural competency with LGBTQ+?
So I think we just need to check ourselves. We all carry our own issues, our own biases, and we should not try to project our own issues into other people. And just remember that people have their own experiences, and not everyone's experience is the same as yours. You might meet a gay man that decided to come out at age 13, and a gay man that decided to come out at age 50. And their story should be respected. The same thing with a transgender person who transitions in their teens, but they decided to transition in their late 30s or 40s. Everyone has their own story, and we just have to be respectful and mindful, and just be open-minded and not judgmental.
Yeah. I want to ask a question about our community. It is so important to have a clinic like this in our community here in Flatbush, and I want to ask you if you could sort of comment on the challenges that our LGBT community has in terms of finding care, because there's the additional sort of stigma of just walking here, especially if they're a beautiful trans woman walking down some of the streets in Brooklyn. And so I wanted you to comment on that.
That's a very good question.
Yeah.
You know, we are aware that there's a lot of stigma that comes from multiple ways. It's difficult to be LGBTQ within the Afro-Caribbean population. Not only that, not only being black makes it difficult, but also religion makes it difficult. And both of these two things, it's a barrier for people to come into anywhere, to the ER, to a clinic. So we know that, we are aware of it, and we'll meet you halfway. We're not necessarily out there, I mean, like we're gay and proud and activists, but we recognize that some people are and some people don't feel comfortable in that environment. And we try to accommodate ourselves to meet the patient's comfort level.
Yeah. You know what I wish we could do? I wish we could have our own little pride parade here.
That would be
you
fun.
know? Seriously. Because I think that, you know, this clinic is so incredibly important. You know, most of our community goes really far away to try to find an ally.
Right.
And, you know, and we need to figure out how to make sure that sort of the people in need are able to get to us. And because once they come into the door, it's all love and it's incredible services. But I do realize that we also need to try to work with our community to try to break down some of these.
Right. And I think at least within Downstate, the institution is moving towards that.
Yes.
Tanya, with the medical students, has been a great advocate for cultural competency on everything, not only LGBTQ. There's other committees within the hospital trying to be more inclusive and offer more services to the community. And Downstate has more allies than we give it credit for.
Yeah.
There's way many more allies within Downstate than people think.
Yeah.
Are there any medical issues specifically that are, kind of impacting the LGBTQ plus community right now?
So there's a few. Definitely hypertension. There's a lot of smoking and drug use within the LGBTQ population, which leads to hypertension and risky behavior like unsafe sex. So we always have to think about sexually transmitted diseases, but it's not only about that. We have to also take care of our mental health. We have to take care of our bodies. Hypertension is a big issue.
Excellent. You have to come back and continue to talk more
Yes,
about
it was
this.
great having you, Hector.
I would be happy to be back.
Please come back. Thank you so much.
Wrapping up another great program on Star for Brooklyn. Program focused mostly on LGBTQ plus youth advocacy and some of the programs that are out there for LGBTQ plus youth. It was really amazing, Tanya, to learn about.
Yeah. I love hearing from the youth taking charge of this issue and doing it for themselves. How inspirational.
Yeah, no, definitely. And the other thing is, from the Theo program to Pride Path to when we had Hector here talking about, some of the medical services and prevention services, just that, there are programs out there, that will reach out, that will try to engage, at the level that, that certain people might be at. And so I don't think a lot of people know that. And so it's important to get that message out there and let people know, like, number one, of course, you do have a voice, we hear it, and there are some places you could go to get that help and to get that, sort of like that foundation you need to be healthier in your life.
And we really are in a moment in terms of cultural competence. It's not, it's an ongoing process, and we need to be more mindful so that we can be better co-workers, that we can, respect people's dignity and meet them where they are.
Definitely.
What a great show.
Definitely. Well, we'll be seeing you next time soon. So
don't
remember,
forget,
#BeHealthy4You.
Healthy for you.
Take care, everybody.